what is the popping sound? What's the crack per se? That's always a big one. You know, I think the joke, right? We adjust, you know, eggs get cracked, people get adjusted type thing, but there is noise associated with how we do adjust here. There are a lot of different techniques within chiropractic. Some techniques, there is the noise associated with the adjustment. Some techniques, there isn't. But here, what we choose to do is specifically our technique work has at its basis a technique called Gonstead, and then also Thompson, which would be some of the drop tables that we use. You guys hear clunking and making some noise from time to time in here. But specifically, when you do hear that noise with the adjustment, that's not a bone breaking. That's not a bone snapping in half. That's not ligaments tearing, muscles popping, or anything like that. What that actually is it's actually gas being released from the joint as that joint moves. So it's called a cavitation. Basically, that joint will open up, and as it does, those gas bubbles that are in there essentially pop, right? So no different than maybe bubble wrap. When you take bubble wrap and you put pressure on those bubbles, they pop and make a noise associated with it. Or even, you know, some of our younger patients, every little boy loves a fart joke, right? So what do we use with that? We call them our bone farts, because what a fart is, it's a release of gas. What's that noise? It's a release of gas. So we joke sometimes, even with our little guys that are a little nervous about getting adjusted or hearing that noise, that they're really no big deal because they're just bone farts. So there you go. What is that crack? It's just a bone fart, but hope that makes you laugh. But yeah, it's just gas being released in the joint there, and doesn't mean it's a good or bad adjustment either. Some adjustments, and depending on, you know, person to person, that's different. Some people make a ton of noise. Some people make very little noise as far as the adjustment goes. So again, don't base your quality of your adjustment based off of that, because that varies day to day, how much water, hydration, so many factors play into that. But I do promise that when we adjust you, we are giving the best, most specific adjustment on that day for what is going on and what we find and feel is best professionally for you. So that's the noise, just gas.